Here at the hospital, we do what we can, but we also have many communities that surround Red Oak, and these small communities are the places where people live and have made their homes for years. Maybe they're retired there, maybe they have transportation issues. We want to reach out into those communities, and the way that's been traditionally done is to build a small clinic in a town and then come periodically through the week. We have a number of small towns that surround Red Oak, and throughout Montgomery County, we felt that building a small facility in each one of those towns may not be the best use of resources. So we looked at mobile technology and mobile technology in terms of a vehicle. Heartland Mobile Health was born out of this need to address access and get out to our small towns. Therefore, it really solved a number of problems. Access, because if you can get to an appointment when you're sick, you don't have to go to the emergency department. That really speaks to the affordability issue. If you're working all day, especially in a factory or maybe on your farm, you can't just leave. You need to get things done. So now you're after hours, you don't feel well, and so Heartland Mobile Health addresses that because we're available after hours and on the weekends. So we're responding to this access that people need in the times and places where they need it.
When the mobile unit came to our area within the past few years, I was not skeptical at all because I knew that we would be getting the same great care from the hospital. It is a full-service doctor's office on wheels.
Having the care at my front door is wonderful. I don't have to drive. I don't have to go to the city where it's a hassle to drive in and out and have traffic. I know the same people are going to be in the van every single time. I know that the care is going to be good, that if I need to be able to go to the hospital, they can send me that day.
Yeah, it kind of makes you think about the old doctors that used to make house calls and stuff like that, because this is very close to everyone's house here. I mean, they go to other towns too, and it's the same feeling for those in those small towns. It's basically a house call bus is what it is, and they're right here for us, and it's a couple blocks.
The mobile unit is the future of healthcare because of the convenience factor. There are too many times where you don't have the ability to get into the doctor on that same day when you need to be seen. And before the mobile clinic in small towns, the only option is that you have to go to another hospital or another doctor's office, which could be 45 minutes to an hour away.
When that mobile health unit rolls up, they know you by name, they know your kids, they know your husband, they know your family, and they're willing to go that extra mile for care. You're not just another number, not just another chart, and that's important. You need to feel like you are a person, and I think that the mobile health units give you that. If they're not around, I'm not sure what rural health care is going to look like in 5 years.
If the mobile clinic wasn't available, I might just decide I'm not that sick if it's me, to make a trip somewhere, drive to Red Oak, drive to wherever.
Being able to rely on this clinic allows for my family to be healthy as well as get back into the swing of things quickly because our family is fast moving, so is the world. That is the one thing that I really rely on this clinic for, is for my family to be able to come here to see a doctor that's knowledgeable, that understands, and that treats us with respect as well as treats the ailments and gets us back going as fast as possible.